This is Jerry Hesch from Hesch Institute in Aurora, Colorado. And my client Gina has been kind enough to let us film her. And she presents with tightness in the upper trap muscles, which is chronic, and cervical discomfort. And she appears to have rounded shoulders, but it's not about appearance. Because appearance is just how something looks. That doesn't tell us about how it functions. And if we then test mobility, just like her sternum or a rib joint, we should be able to take up the slack. So we move it to an end point, and then we add an additional small thrust, and there should be movement within the joint. When I come and I capture the acromion, and I try and spring it obliquely at a 45-degree angle, I can't even take up the slack. It's extremely rigid. When I come on top of her clavicle and I try and take up the slack going inferiorly, it's extremely rigid, can't do it. And if I add a moderate amount of force, there's still no give. And if I push posteriorly on the lateral clavicle, there's no give. And there's a beautiful self-treatment for this. Strengthening always makes sense. Strengthening your upper back, your interscapular muscles, middle trapezius, rhomboids. But before you can do that, you want to restore normal joint play. And let's have you lie on your stomach. So what I use is 4-inch round foam, and I place it under each shoulder, making sure that I capture the acromion. And so this is 4-inch diameter open cell foam, and we purchase it from FO America. And so I place the 4-inch diameter under the shoulder. And you also, I cut it in 5-inch lengths, so you also have the option of going at 5-inch, but we'll start at 4-inch now. And I'm going to have her do that for 3 minutes, and then I'll come back and I'll film the response. And it's a little hard to find 4-inch foam, but you can try, do an internet search. Otherwise, you can buy it in 72-inch lengths from Fomerica, and again, that's FO, and then America.com. And so I'll stop filming now, and then I'll come back and we'll film her response to this.